Everyone. So we'll get the session started. So this session is talking about fostering local ownership, and we have a number of speakers for you today who will give you some background regarding, some of the best practices they've used to make things successful in their own settings. So just as a quick outline, so you guys know what you're getting into here. So we'll start with a brief intro. I'll kick us off. And then we'll hear from two countries. We'll hear from Ghana. We'll hear from Dr. Salah here, who's joined us. And we'll hear from Tanzania as well, Mr. Claude, who will give us a bit of a background on what they've done there. Then just to give a broader regional perspective, we'll hear from Edem, who will talk a little bit about perspectives from the region. And of course, he has a good perspective just on the overall work that we've done as well. And then we'll ask the three participants to come up to the front here, and we'll moderate a bit of a panel discussion. You'll also have an opportunity to ask them some questions as well. So just real quickly to frame the session, what we're going to talk about today is kind of how these countries have got to this more mature state and a sustainable place. We now have a lot of guidance and tools and, frameworks to support this. But at the beginning, we weren't really there yet. So while we have kind of these nice diagrams now and accompanying guidance for all of the steps included in this, at one point in time, we didn't have much of this at all. So a lot of the countries started off without this in place. Ghana and Tanzania have been, implementing DHIS2 for a very long time. And they had to start off without this information. So they had their own approaches, their own kind of ways of introducing these foundational principles in their own settings. And, they built on this over a very long period of time. Just honing in on one, we have, for example, training, core teams, and some other guidance that we've developed since then. But of course, we didn't have any of this at the very beginning, right? So it was all just kind of based on what they thought would be best practice. And, since then, they've built upon that. So I'll invite our first speaker, Dr. Salah, who will give us a bit of a background on what they did in Ghana and where they are right now, as well as some of their future plans for kind of building this local ownership within Ghana, given the context and setting there. Thank
you. Good morning, everyone. So my name is, everybody calls me Salah. So I'm here to present on the Ghana's journey in implementation of DHIS2. Yes, so DHIS2 implementation started in Ghana a little over a decade ago. It started in 2012, and it was immediately adopted by the Ministry of Health and the Ghana Health Service. So the Ministry of Health is the health body, overall body in Ghana, and the Ghana Health Service is the largest agency under the Ministry of Health. And it was adopted as the National Health Management Information System when it started. So the plan was to ensure that we build a robust, decentralized system and also be able to have in-house expertise to be able to run DHIS2. And now DHIS2, we can say, has now become the service delivery reporting to data quality and decision-making tool in Ghana. So to talk a little bit about in-house capacity building to ensure that we sustain DHIS2 was the early prioritization of the Ghana Health Service to develop a DHIS2 capacity. We had 10 people who had advanced level training to be able to ensure that they provided remote support to all the facilities and all the health, in all the health system. And then we had a cascade of system administrators from the national level to the region. So we have 16 regions in Ghana and 261 districts. So there was that cascade of system administrators to be able to ensure that we had a decentralized support system to be able to implement DHIS2. Senior managers were trained from the headquarters level, regional and district level as well, to ensure that they could oversee and monitor what was being done within their regions and their district. And then the culture of data use and ownership was developed alongside all these initiatives to ensure that people were not just producing data, but also using the data as well. There has been a lot of high-level government engagement or senior management, which was central in the implementation of DHIS2. In fact, I think the acceptance was even faster and quicker than anticipated at the beginning. And the Ministry of Health itself led the development of the National Health Information System Strategy and placed DHIS2 as the core national platform and not a donor project. I think that was a critical step to ensure that people accepted and trusted the DHIS2, because if they thought it was a project, then it will have diverse interest and all that. And we went ahead to be able to develop standardized data collecting tools, SOPs for data management and then verification, and also user manuals to ensure that we had consistent practice across the country. There have been some key successes when it comes to the implementation of DHIS2. One of them is the fact that leadership's commitment to DHIS2 and the ownership from the Ministry of Health and the Ghana Health Service, and then also the development of the National Health Information System strategies and SOPs as well has been a great further to ensure that DHIS2 implementation is sustained within the country. The core national DHIS2 team has been trained and retained. It is a very dicey issue, but to a large extent, we have managed to actually retain a very good number of the core team, and that has been one of the strongest reasons for DHIS2 implementation so far. And then the cascade of training, that the model that was used to ensure that we had support at every level of care so that we could ensure that capacity was spread all over the country. In terms of infrastructure and then technology enablement, it doesn't matter how much how beautiful the system is. It is really important for you to have infrastructure, or how beautiful even the team, or how well the team is trained. So we have had quite stable service and connectivity, backups, and then power systems to ensure DHIS2 implementation within Ghana. Also, the use of data, being able to develop a data use culture. So now the DHIS2 data is what is used across the country for decision making, for performance, for appraisals, and for review meetings. So you are sure that people are looking to always eat the meat of DHIS2, and that is the data we generate. And then we have also enjoyed community and peer networks as well. Peer learning accelerates solutions and innovations, and we have been fortunate to have a lot of support as well from the larger DHIS2 community. In the midst of all the sweet successes we have been able to achieve, we have had issues or some challenges around still retaining some of our staff, because they become so good that the donor community also just keeps tapping into them and picking them away, and that is an issue for us. There's limited IT skills as you go the sub-national level, so it still calls for more monitoring and hands-on oversight to ensure that the system is running well. To talk about consistent funding, especially in the midst of the times we are in, for capacity building and DHIS2 infrastructure has also been a challenge. Initially, the dependency on external technical support was a challenge, but now I think we have a more stable team. And also there was a slow institutional adaptation of the standard operating procedure. So we still have a need to go over and over again and have a lot of data quality checks because of the slow acceptance. And difficulty in coordinating across programs. There are vast programs with different interests. And the interesting thing about DHIS2 and data collection is sometimes the programs think as long as you have DHIS2, then they don't work. So at the end of the day, you keep having challenges and people coming up with things. And then resistance to data use culture by some levels of care is still a challenge. We have learned some lessons that to be able to sustain or own DIMS, have local ownership. It is very important for you to have the buy-in of the authorities, be able to cascade training across every level of the healthcare delivery system, and then standardization as well promotes data quality and user trust within the system as well. Leadership engagement has driven all the successes we have made in the past decade. And then sustainability for DIMS as well requires institutionalization and budget commitment, which is something that we are working towards. So we are looking ahead in Ghana to ensure that there's institutionalization of the DIMS2 roles within the public sector human resource structure so that we have the chance of retaining staff is higher. If the staff can know that this is their trajectory or this their career path, it's easier to be able to retain staff as well. And then expanding digital literacy to the sub-national level is key for us to ensure that we can sustain them still within the country and even expand. And then to be able to formalize mentorship programs for junior staff who join the service at every point in time, and also to be able to rope in the private sector is a very critical thing as well. Collaborating with academia for ongoing innovative research is one of the things we are looking out to be able to achieve. And then building a self-sustaining ecosystem for DIMS2 experts is our goal as we move ahead. Thank you.
Good morning. I'm Claude John Kumarija from the Ministry of Health, Tanzania. As well as I'm going to present on fostering local ownership for DHIS2 sustainability. I'll focus on the health profile, the governance of DHIS2, major achievements, efforts of the government to ensure sustainability, the role of development partners and the TA support, but also I shall present on opportunities for sustainability, major challenges, threats, and focus areas. Tanzania is one of the largest countries in Africa with 60 million people, with 12,000 health facilities, and they are semi-computerized. It's hybrid use of ICT and paper-based. This is a snapshot of where we are coming from. Up to 2015, the way we used to store our data, and it was difficult to retrieve when you are making national summary. You needed to work hard because the files and the papers were all around. But currently, we have data warehouse where we can retrieve data. Again, those times, it was very difficult for reporting and making analysis of paper for dissemination. It was really complex to know where to report it, where to collect, where to get data, where to make a summary, where to get a national report. But currently using DHIS2, we are able to come up with a web portal, scorecards, we have maps, we use mobile, so we enjoy use of DHIS2. Now let me focus on the DHIS2 governance, how the system is governed in the country. We have the M&A, ICT and M&A Technical Working Group. This is a group where we do evaluation, planning, and the fund mobilization for DHIS2. Underneath, there is a consortium of partners. These are people, the group of people coming from the government, from the, implementing partners, funding partners, FBOs, private research institutions, universities, all this, the one who oversee the DHIS2 implementation on daily basis, and they support it technically, DHIS2. But also, we liaise with international assistance from WHO, we have Global Fund, also university, PEFA, Gavi, and the other to support our systems. The technical working group reported to the TC, the technical committee of the sector-wide approach, which is under the permanent secretary. So the permanent secretary with representatives, the health representative from different organizations, they meet and they make a decision on DHIS2. But also they recommend it to the policy meeting. The policy meeting of SWAP, sector-wide approach, is chaired by the Minister of Health. And also the ambassadors from different countries who support health, they meet. But also the chief of parts from different organizations, they are also members of this meeting. So here is where the main decision on DHIS2 is taken care. So you can see the government of Tanzania, the leaders are well involved on DHIS2, and they are the one who really take all the key decisions. At the regional and council and health facility, there is also structure which govern the implementation of DHIS2. This is the achievement we are proud of. Major achievement, as you can see, monthly DHIS2 reporting increased. When we roll out the national rollout in 2015, it was 65, the reporting rate, but as of today, is almost 100. All the health facility almost report. But also the timeliness, it was at 30%, but today is more than 90%. And data quality, when we do the first assessment of data quality, we find it was around 45%, but today it is around 84%. So you can see they use the connectivity of the connectivity of internet in the hospitals. We have around 400 hospitals, is around 80%. And also the rollout of EMR in health facilities, again, is around 70%, as you can see. What is the government efforts on DHIS2 sustainability? At the government level, central government, it's the Minister of Health, regional and the councils, and the health facilities, we have established a budget line, and which is integrated in the national plan. So whatever we are planning for the health sector, DHIS2 component is taken care. So this is to assure that the sustainability of the system is maintained in the government. Again, we appointed the government staff. We called the HMIS focal person, which is dedicated at Central. We have a team of HMIS focal persons, and the regional and councils. Also, we have those focal persons who are responsible. But at the facility level, all staff are trained on HMIS and DHIS2, so there's to undertake the implementation. The regional health management teams and the district, the council health management teams, they are well trained to coordinate, to make supervision, data quality check, and everything about the DHIS2. So we are sure that the team, whenever they do supervision, DHIS2 is part and parcel of the system. At national and the regional also, we have ICT staff which are employed to supervise ICT undertaking. The role of the funding partners, They provide the resources. We thank the partners who provide the funds and the technical support, but we also implementing partners support on DQA, monitoring, supervision, data entry, capacity building, and the others, writing annual reports and face-based also provide the facility. They use the DHIS2 to compile the monthly and annual reporting. The role of technical assistance, we have Tanzania, HISP Tanzania, and the University of Dar es Salaam have role on the DHIS2 maintenance, troubleshooting, programming, and the system upgrading. But also we have universities, research institutions, major hospitals, which provide technical assistance on DHIS2, morbidity and mortality statistics. But also we work with the Global Fund, WHO, World Bank, PEPFAR, Gavi, Health Basket Fund partners, UN agencies, and the other funding countries, which provide, first of all, they are the one who ask, use DHIS2 data. They have trust on DHIS2 data, so they use DHIS2 data to fulfill their need for Tanzanian data, but also they provide the financial, but also technical advice on DHIS2. Well, there are challenges. One of the biggest challenges is insufficient allocation of funds from the government. We struggle to make sure that the government increase the funding to DHIS2, but still what we get from the government is not sufficient to run in DHIS2. But we have also a challenge of parallel funding from programs and interventions. Most of our partners, they come specifically, they want to support HIV, they want to support malaria, they want to support TB. So taking resources to be national, to be planned for national, it becomes very difficult. At the end of the day, there is parallelism of funding, but also we experience the fragmentation of EMRs solutions. There are so many solutions which does not talk to each other. So also this is a challenge. We are having more applications, more solutions on EMRs, but no a place where they can talk. There are parallelisms. Vertical EMR systems, hence duplication of resources, because everyone is trying to use the resources for the same purpose. At the end of the day, we find a lot of duplication. But you also change of new technology. We use our systems, EMR system, but we find in a year time is outdated. So we need to go to another data system, and so every time, 3 years, 4 years, we go for changes because the system is outdated. The threat of some partners to cut off their financial opportunity also is a challenge that we are forecasting. What is the opportunities for sustainability? We have strong support from and the commitment from the government of Tanzania, especially the high-level leaders, the president and also the ministers and all the key people. They are very positive to DHIS2. Existing funding opportunities from our partners. So we still have our partners who are supporting us. So that is an opportunity for us. But also technical assistance. Also, we are working with technical people. They are with us. So that is a good opportunity also. Especially HISPO and the University of Dar es Salaam, where they have been with us. Or in times we have money, in times we don't have money. They have been with us throughout the implementation. Existence of national fiber optics, cable network for internet connectivity. We are luckily, because Tanzania, we are having the fiber optic cable, so we are now on the effort to connect all the health facilities with reliable internet. Integration of DHIS2 into the health annual government planning and the budgeting also is a good opportunity for us because we have a budget line, so we are making hard to make sure that there is sufficient money allocated from the government. Local innovations towards data analysis and dissemination, public portal and analytical messengers. We are trying to come up with innovations on how to disseminate our data. So these are the opportunities. What is the focus areas we are focusing on? Now we have massive data in our systems. So we are looking capacity building on big data analysis and data science. So we have numbers of staff that need to go training on how to make massive analysis of data. But also we still need DHIS2 maintenance on programming and system upgrading. This is the role of our technical assistants, especially HISP and the University of Dar es Salaam. Develop digital DQA, WHO data quality, and spot check. Again, it was manually before, now we are going to electronic, so we needed to develop electronic systems. Develop data communication strategy, which will involve data analysis, data dissemination, and the use at all levels. Support health facility, community, EMR, AI, and telemedicine rollout countrywide. These are the government initiative to ensure that we have electronic system, artificial intelligence, use of artificial intelligence, telemedicine countrywide. Support data, the repository, data warehousing, and interoperability. Again, it's challenging how these systems to make them talk together and come up with a central data warehouse where all data can be available. Support infrastructure, enterprise architecture, networking, HDU app, API, and equipment. So it's a big investment which require funds. Those are the areas we are focusing for the future. After being said, so thank you very much. Asanteni sana.
Hello? Yep. Yeah, it's better. Hello, can you hear me? Okay. Like this? Okay. Good morning. My name is Edem Kosi from HISP, West and Central Africa. So this morning I don't have a presentation for you because I think many of the presenters will have the opportunity to cover most of the points. So my role here is to share my perspective on what is needed for ownership and sustainability, and just emphasize on some key elements, and if there are some points that are also missing, to share them with you. So in my opinion, I think first of all, when you talk about sustainability, you want to sustain something that is successful, isn't it? We want to sustain a system that is failing. No. So what I'm going to focus on here is what is needed for a successful implementation, and then how to sustain it over time. So I think, first of all, we have about 6 critical dimensions that are mutually self-reinforcing when we want to talk about ownership and sustainability. And those points are, for me, first, capacity. You cannot say I own the system or have the ownership over a system if I don't have the capacity to maintain it or to evolve it. You need also to have a proper way or an approach that will help you to keep innovating, which is the way we approach the system design. I will talk about participatory design. Governance and leadership, the presenters mentioned them. Funding is very key, and particularly in this current situation where we have seen that there are some funding cuts in terms of health information system. Data use, community of practice. So those are the 6 points I want to quickly talk about. The first point is capacity building. The team itself, and then the capacity building. First of all, if you want to have a team that can really support your system, maintain it, and get it evolve, then you need to have a team of a good size. If you have a small team of 1 or 2 people, then they will be distracted with many things. They won't have time to practice, to learn, to master, and also deliver. You need also to have a multidisciplinary team. So it's not only relying on IT people to come and do the work for you. You need to have a multidisciplinary team of public health, data science, IT, server management, and so forth. And then you need also to emphasize on learning by doing, and particularly if you are able to start your DHIS2 implementation. So it's not about taking people from outside to come or develop a system in their laboratory and then bring it to you, but to work with your people to develop the system and try to help them to learn by designing the system themselves. And I'm not going to talk about all aspects of the capacity building, but some key elements that I think we need to emphasize on. We need also to bear in mind that capacity building is not one-off activity. Usually when we discuss with partners, with donors, they will say, oh yes, we have paid this, we have invested 2 years ago in building capacity, and now we are still talking about capacity building again. No, capacity building is a continuous effort. Why do we need to approach capacity building as a continuous effort? Because first of all, in your country, you need different level of capacity. You need capacity for people who are maintaining the system. You need the capacity for those who can train the users, and the end users also need to have the capacity to use the system. So all these kind of capacities, you need to keep them within the ministry at any time. Because of the turnover, if you have those capacities in your system, then once one goes, you hire a new recruit, you have the possibility to train him. That's the first thing. Second thing, the system itself is evolving. DHIS2 is coming with new functionalities. This morning we heard of CHAP and so forth. So you need to keep investing in those in your team in terms of capacity so that they can catch up with whatever is coming as new technology. Now, on the participatory design, I think the best way, and it's well known that if you want to innovate, then you need to listen to everyone, to the end users, and not leave the design of your system in the hand of the ITs. So talk to the end users, even if you are not in the beginning of your system. Whenever you have opportunity to design something new, always bring the end user so that you have the opportunity to take into account their concern, you empower them. And if they are empowered, then they will be confident in using their system. They will see that the system is supporting what they have been doing. The third point is governance and leadership. Again, I'm not trying to talk about what has been already said here. But for me, what is very important in terms of governance and leadership, the first point is we need to have in place the coordination bodies. You can have your DHIS2 technical team that can meet on a regular basis, work together. You can have a technical working group that can be outside the HMIS team and involve other health programs and so forth. And then on top of that, you need to have also a steering committee that can provide oversight where they can meet. And if there is a need to do resource mobilization, to give some political orientation to the implementation of your system, they can have us. So those elements are key. And you have seen in the past that the coordination bodies are also opportunities for the country to get a consensus, to document the gaps. And once the gaps are documented and they have the consensus on the way forward, then it's easier to mobilize the resources because it's not only X saying this, it's not Y saying this, but it's the whole set of stakeholders in the countries that have agreed on this particular problem. They said it's their priority and this is how they want to move forward. The other thing that is also important in terms of leadership is the trust that the leaders have in their own team. So if you trust your team, you acknowledge what they are doing, you value their work, then they will be always encouraged to be doing more, to take on new innovation, to better support the system, take it as their own because their work is being acknowledged and valued. And that is key for many people. And that's why you will see in some countries that although some partners can come and tempt them with high salaries, they will say, no, I want to stay within the Ministry of Health because what I'm doing, I like what I'm doing, my work is being valued and is morally rewarding for me and everything is not about money. I mean, some may go, of course, but not everyone. Yeah. The fourth point is data use. And I want to highlight the point about the culture of data use. And when we talk about the culture of data use, it's like any kind of culture. And as any kind of culture, you have to enact it and reinforce it through folklores. And what are those folklores? Is the review meetings that we usually do at various levels, district, province, central level, the planning exercises, monitoring and evaluation, whatever we have should be the opportunity to reinforce that culture of data use. And most importantly, we need also to focus on our system should be generating or producing information that is relevant for people from the grassroots where the data is being produced. So if they are just to work and report the data and see the data fly in the skies and not getting anything back, then your system is likely to fail. So that's why it is very important, although we have some constraints, we need to take into account the need in terms of data for those who are at the lower level. Funding. As I was saying, funding is very key to this because at the end of the day, to get your system operational boils down to the resources you have at hand. So if you don't have appropriate funding, the system will collapse. So how do we fund our system? And this tough time that we are going through now is teaching us great lessons. if we rely only on partners to fund our system, then the day the partner will have other priorities, our system will collapse. And that's why we need to seriously work on getting the resources from the national budget to fund the HMIs. I know this is still the challenge for many countries, but we have to get there to start with something. And sometimes I'm not going to blame the partners, but sometimes you can mobilize resources. I've seen it in a country where we have managed to mobilize resources in the country budget, but then another partner came and said, "Oh, no, don't worry, I can take care of that one." So that year, they didn't use the government's budget, they used the resources from the partner. And then the next year, the government said, "No, we have secured the resources for you last year, you didn't use it, so it's not useful for you." So again, we need to find a right balance between what the partner can contribute to, but the key functions and the core functions of our system should be funded through the national budget. Community of press, I think that, you have already said all about it. There's no need to say anything. So those are the key elements that I wanted to share with you in terms of what is needed to have a successful system that can be sustained by the local team. Okay. How many are we?
It's three of you.
It's three?
Yeah.
Okay, let me sit here. This is like sitting in a bar.
Yeah, I like these chairs. We have that other chair there too, if you want to use it.
This guy, isn't it?
It's like, okay. I can help you. Yeah.
I don't know.
So we're going to have a brief discussion now. I've just added, you can see here, it's not appearing automatically. We'll look through the questions, but if you just join this link here, you can ask some questions if you'd like, and we'll have the panel take that up. We'll probably select one or two questions from there. If you join and other people are posting questions, you should be able to vote on those as well, thumbs up, thumbs down, depending on if you think the question is interesting. Okay. So once again, here are our panelists, Claude, Adam, and Dr. Salah. So my first question for them here is, what do you think are some of the emerging threats to sustainability given the current global situation? And who would like to take that on? Dr. Salah, please, I see your...
Hello.
Oh, is it not?
Hello. Yes, so I think that has been spoken a lot actually by Edem as well. It's being able to get the government to be able to allocate some funding to ensure that the system keeps running despite the fact that there are donors or not. And also, I think parallel interest in terms of systems and who wants to achieve at every point in time. Being able to get, I think that just when we're having the presentation, I was discussing with one of my team members as to having a very strong steering committee that for every system that has to be developed, it has to pass through that steering committee to be able to get a pass, or else we'll keep having competing systems, and with the limited budget, we'll keep having issues around sustainability. You want to say something?
Okay. Yeah, I can quickly add something. I think the lessons we need to learn from this current situation is that in good times, when you have a lot of resources coming in, then you should focus on what can strengthen your system. So it's not because you have resources that you can start duplicating efforts. I want to invest here and there and so forth. So you need to have to harness these fundings that are coming from the various partners to support your vision, to strengthen the system you have, so that tomorrow, if you don't have those funding, at least the resources that you have received has taken you to another step. And we have seen that in this country, in this context, some systems that were developed as parallel systems, they just collapse. And the only thing that remains is, in some countries, just, I'm not bragging here, but it's just DHIS2. So it's very important to, to think of how to harness the funding in addition to securing also whatever you have, securing resources from the government budget.
Yeah, as I said in my presentation, we have a structure, the government structure, which DHIS2 is part and parcel of the.
Make sure your mic is on. Sorry. It's on. Is it on? Was it on? Okay, then wait. I'm hearing the voice level.
Yeah, which DHIS2 is part and parcel of the Tanzania government structure. So we are, as a country, we work with our development partners who support us financially and technically. But if they are not there, Tanzania is our country. So we will take everything and make sure that systems run, including DHIS2. So we are well prepared, good structure we have, good governance, and from the top Minister of Health down to the health facilities, where already we have good infrastructure and setup to make sure that DHIS2 we ensure sustainability. Thank you very much.
Yeah, thank you very much for your responses. So we actually have a question from the audience. This is for Dr. Sala and Claude, I believe. To both countries, how have you made the staff stay in your local DHIS2 teams, and how have you motivated them?
Very interesting question. I think, first of all, I think for our team, I'll just say they love their country and they love what they do. I think when Edem was speaking, one of my team members said, when you spoke about the fact that you have to motivate the staff to be able to keep them, then I was smiling and I was like, I'm not even sure we are able to motivate them enough. But I also think that one of the critical things was because they were trained, they were staff who were within the system, and they were trained whilst being in the service. So we used our own, we built the capacity of our own. So as much as we still have a lot of people leaving, to a large extent, we have been lucky. I wouldn't say that it's been intentional. That's why I'm struggling to answer the question. I wouldn't say it's been intentional, or we have put in intentional steps to be able to maintain the staff. But I would say that these staff were people who were already in the system, were trained in the system, and we have been lucky to have them stay till now. And there has also been some continuous capacity building, even though there's a lot that needs to be done to have very high level capacity building to ensure that there are more people in the team that can perform that core responsibility.
Mr. Claude, do you have anything to add regarding how you've kept your teams in place in Tanzania?
Yeah, for Tanzania, everything is taken under the government system. So even the issue of capacity building, the trainers, the system administrators, they are all of them are government employees. Although we work with our partners who support in some areas with the data focal person to ensure data collection, data quality, DQA, and review of monthly summary reports. But the big chunk of the work is done by the government staff at the council level, at the facility staff. Every staff at the facility is well trained. At the district level, all the supervisors, the district, the council health management teams, they are well trained on DHIS2. At regional, the same. At national, the same. And all the program managers and their staff, they are the users of DHIS2. So capacity building is done everywhere. And most of the staff in the ministry, they have credentials to enter DHIS2 and see and browse generate reports and use of DHIS. So it's well structured to ensure sustainability, but also capacity building at all levels. Thank you very much.
Thank you. So we'll take on one more question from the audience here. What are the most important factors in successfully establishing a culture of data use?
Okay, so like in any culture, there will definitely be people who are resistant to the changes that come. But I think that in terms of this, at the end of the day, a lot of people want to keep their jobs. So I think that being able to use data as a performance tool is one of the things that has been the main driver of data use in Ghana. So it is used as a performance tool. It is used for performance agreements from senior management level down. It is used for appraisals. So your appraisals are your performance is literally based on what the data speaks. I mean, in terms of DHIS2. So that has been critical. And we use DHIS2 data is what is used for all our reviews. For our health sector, medium-term strategy as well. It is the DHIS2 data that is used to be able to speak to the indicators that have been put to ensure that we can see how far the country is going in the health sector achievement. So I think that has been one of the drivers or some of the drivers that have been used to ensure that the data culture is being accepted across the country.
For Tanzania, data use is really complex. If you go to the health facility, you find the use of data. They use data anonymously. For instance, tracking defaulters, vaccinations, coverage. They use the data, family planning, ordering of family planning. But if you ask them, do you use data on your routine? They will say no, because they don't know what it means by data use. So under data dissemination, data analysis dissemination they use, we need to come up with a guidelines which will facilitate staff at the facility level to know exactly how data is used and what does it mean when we say data, what is data used. currently we use data, but it's not formally. They use it at their own, but once you ask them, for instance, our partners, our development partner, when you go to the facility, they come up with a response that we went to the health facility and the health staff, they said, no, we don't use data. So because we haven't yet trained on how best to express what is data use. That is what we are missing in my country. So we need to come up with data dissemination and the use strategy so that they can know exactly at my facility, how do I use this data for me in planning and ordering, in determining. Thank you very much.
Yeah. Oops.
Let's move it.
Okay. Oops. Still ringing somewhere. Oh. Okay. I think, first of all, we need to do justice to the people in the ground. We usually say that data is not being used, but I think in reality, they are doing their best to use the data. The question is, how can we, is it working? The question is, how can we improve that data use? And how to improve it will vary from one context to another. There's no single solution that can work everywhere. That's why it's also important to be able to identify what are the barriers for data use in the countries. It can be sometimes the easiest thing they will tell you is funding, but that's not always true. And we need also to look at what people are required to do, because usually when we talk about data use, it is related to the mandates that they have. What are the power or the possibility they have to act upon the data? So if I see, I'm a health facility in charge, and I see that I have a stock out or my stock level is very low, and then I know that even if I report that, I won't get anything month over month. Why should I keep using that stock out data? Because I know I have no power. Same for other things. So I think we need to put this into perspective and say, okay, what is the reality in the grounds? What people are required to do? What are they doing now? What are the barriers? And then develop the appropriate solutions to address those barriers. Yeah. And if you allow me, I want to say something on the first question, if you have time. Regarding how to keep the team. I think there is another important thing we need to look at here is the vision. When you have the technical people or the technical team, and particularly when they are young, it is easy for them to project themselves in time to say, okay, this is where we want to go. So, and if I take the case of Ghana Health Service, I know I'm not saying that Kwame and his team are young. At least 10 years ago, they were a bit younger. I believe it is easy for them when they have that vision. The vision that the leaders of the system are sharing with them. This is what we want to achieve. We want to go there. Then they will be very enthusiastic to take up new challenges, because they know, okay, along the way we are going to do X, Y, Z, and they see themselves in the driving seat in doing X, Y, Z, and that can also contribute to keeping them. But if they are in the system where the only thing they have to do is to create data elements, create data sets, they have to do the same thing over and over again, at one point they will be tired and they will look for only challenges. So you need also to give them new challenges. And when they are a bit younger, they will be happy to take up those challenges. Yeah.
Okay, thanks, Adam. So this will be the last question for the panel here. So what strategies have you used to finance the system? And more specifically, have you been successful in allocating government funds to maintain the system over the long term?
Yeah, so I think in terms of financing, there's the part that is the remuneration of even HR, human resource, which we don't take for granted that the government takes up that to some extent, especially because now for the core team, they are identified as staff under Ghana Health Service. So that is it's what takes care of that. And for server space, we've managed to integrate it into GC7 with the Global Fund to be able to ensure that that funding is achieved for some period. So that has been so far how we have sustained the DHIS2 actually in Ghana. Yeah.
Yeah, for Tanzania, because we in the implementation of the DHIS2, we use government staff, and government staff are paid through the government. So the salary, keeping of the staff is done by the government. But the running cost, as I said, now we have a budget line dedicated for the DHIS2 and in the data. So the government provide the budget on the annual basis to make sure that there is smooth implementation of the DHIS2. However, we work with our partners who support us financially, but also some of our partners have employed human resource to support it. The councils, the regions on the data management, data quality, data review, data supervision, monitoring. So we are continuing to make sure that we improve the allocation of funds from the government to sustain it. Thank you.
Okay, thank you very much to our panelists for answering our questions. There's a couple of audience questions, but I think we'll follow up with those individually later on to get you some responses to those. So I'd like to thank our panelists and presenters, and we'll end the session here.